Hi, my name is Maria, and I will be presenting on why U.S. healthcare should be made affordable for all citizens. I first want to start off by highlighting the problems that arise from our healthcare system. Currently, the expenses for pharmaceutical drugs and insurance are endangering Americans. This year alone, pharmaceutical companies raised the prices on more than 250 prescription drugs, and as a result, 3 in 10 Americans said that they did not take their medications in the past year as directed because of this expense. Additionally, a 2018 survey published by Becker's Healthcare found that 22% of Americans found that paying their deductible was very difficult or impossible, and 64% reported that they delayed or did not seek medical care because of the cost. What is shocking is that 28.5 million Americans in the U.S., which constitutes 8.8% of the U.S. populations, do not have health insurance. According to a study from Harvard researchers, this lack of health insurance is associated with as many as 44,789 deaths per year and translates into a 40% higher risk of death among the uninsured. Looking at ethical perspectives, like the rights approach, Rawls' approach to justice, and virtue ethics, it can be seen that making U.S. healthcare affordable for all citizens is moral. Under the rights approach, it's arguable that medical care should be more affordable, as the current U.S. system infringes on the moral rights of those affected. Kant argues that humans have a dignity based on their human nature to reason, and that following the formula of humanity as an end, everyone's rights, like to life and human dignity, should be respected. The United Nations Universal Declaration of Human Rights has even stated that everyone has the right to a standard of living adequate for the health and well-being of oneself and one's family, including medical care. Additionally, in 2005, the World Health Organization signed the World Health Assembly Resolution 58.33, which stated that everyone should have access to health care services and should not suffer financial hardship when obtaining these services. The UN and the WHO clearly state that humans have the right to health care, as it is crucial to live. So in order to not infringe on these rights, the US should implement Medicare for all. The justice approach addresses fairness, and in this case, fairness concerns distributing the benefits and burdens according to need. As we are born into the lottery of life, we have no control over the distribution of things. Additionally, under the veil of ignorance, where no one would know their position, strengths, or weaknesses, a moral system of distribution will be reached. R. Rawls argues that the difference principle will become a result of this decision, as no one would want to be oppressed, and they would actually want to be helped if they found themselves in this position. Following Rawls' difference principle, there is a moral obligation to help the worst off in our society, as currently it is seen that almost 30 million at the bottom of our society cannot afford medications or treatment. We ultimately have a responsibility to help these people, and Medicare for All will achieve this goal. Virtue ethics, in turn, argues that an action is ethical when it conforms to what a good person would do and provide for the full development of our humanity. In this case, a good person would support the government providing medical coverage for all. This is because under bioethics, non-maleficence, or preventing people from pain and harm, and beneficence, promoting good and helping people, Medicare would appeal to both. It would ultimately fix the issue our healthcare system has, as 11.4 million uninsured working age Americans with chronic conditions such as heart disease and diabetes, and their lack of insurance will lead to the harms associated with less access to care, such as early disability and even immature deaths. Ultimately, a good person should support Medicare for all, as it would prevent the harm seen and help people with illnesses. However, critics for Medical for All will argue that it will lead to a rise in taxes, a decrease in the resources available, and it would stunt innovations. It is estimated that the government must raise $3 to $4 trillion a year in new taxes to fund this. Libertarians would argue that this is an immoral and an unnecessary action. Libertarians believe that we are separate individual beings with self-possession, the right to liberty, and the right to choose freely and live as we please. Therefore, through the principle of self-possession, libertarians argue that the government cannot redistribute income from rich to poor, as must be done to provide Medicare for all. These taxes are not necessary to the protection of the country, and therefore, if the government tries to implement them, they would basically be taking people's properties and instituting a type of slavery. Through their libertarian perspective, it can be seen how increasing taxes to implement Medicare for all would be immoral and infringe on the right to self-possession and property. Additionally, critics will argue that the availability of resources will diminish and that wait times will increase. In the average wait time to see a specialist in Canada was 60 days, compared to the 24 days in the United States. Additionally, in the United States, only 25% of patients had to wait at least 4 weeks to see a specialist, compared to 59 in Canada, 56 in Norway, and 43 in the United Kingdom, which are all countries who have some form of universal health care. Critics could support this point of view through Aristotle's theological reasoning. Theological reasoning looks at the end result and claims that there are things are virtuous and therefore moral, fulfill their natural job. All justice has discriminations, but if we instate Medicare for all, the quality of medicine will decrease and may not fulfill its niche. Additionally, justice is unequal for unequal individuals, so people who have the means should be able to get better health care, not be suggested to worth their health care for the sake of equality for unequal individuals. Additionally, it is arguable that by having Medicare for all and allowing it to drop prescription prices and create more competition for name brand drugs, that this will stunt America's role as the number one country for pharmaceutical innovation. Even patient advocates do not want politicians enacting policies that would prevent the industry from discovering the next big cure for, say, health disease or dementia. Virtue ethics may be utilized to argue this point, as a good person may not support Medicare for all as it does not appeal to the business ethic of commitment to excellence or the American value for hard work and productivity. It may not be virtuous to stop money influx into big pharma to demotivate innovation and excellence in new treatments. Medicare for all is important as it seeks to protect the right to life, while those opposed to it value material goods such as money. The right to life is arguably the most important in the sphere of bioethics, as without it there cannot be an enjoyment of any rights or even property and money. The important stakeholders are the U.S. government, Americans, doctors, and insurers. When the U.S. medical system becomes single payer, as people would pay the government instead of insurers to receive care, total public and private healthcare spending could be lowered to up to 1.8 trillion over the next 10 years due to lowered administrative and prescription drug costs. The American Medical Association reports that private health insurance plans spend 11.7% of their premiums on administrative costs versus public health programs only spend 6.3%.